Welcome to The Wellness Effect. I'm your host, Seth Mully. This week we've been discussing universal healthcare. So if you missed the last episode, go to our YouTube channel to catch up. The NHI has been a widely discussed topic in our country for quite a few years and could possibly change the landscape of healthcare in South Africa. But how do medical aids see the NHI? To help us delve deeper into this topic is our guest, Teddy Mosomothane, CEO of Bankmed, one of the leading medical schemes in South Africa. Teddy, thank you for joining us today.
Thanks for having me, Seth. I'm very pleased to be here today.
So in our last episode, we spoke about the importance of universal healthcare, and Bankmed has been operating in South Africa as a medical aid for the last 100 years. What's your position on universal healthcare?
Seth, first and foremost, thanks for having me here. I'm pleased that I'm here to participate in this conversation. One of the points that I think it is important for me to make up front, and I promise you I will answer your question. Universal health coverage / national health insurance is sometimes used interchangeably.
Absolutely.
And it has been a topic that has attracted a lot of comments and frustration from those who have keen interest in the matter. What I would like to do in the course of our conversation is to highlight the distinction between universal health coverage as an overarching objective.
Brilliant.
And national health insurance as a vehicle through which the South African government has chosen to pursue universal health coverage.
I love that.
Now, I'm clarifying this because many of us will have picked up the stakeholders who have responded on this matter have often said they are supportive of universal health coverage, but they have a challenge with the pursuit thereof via a vehicle called national health insurance in South Africa. But now to get to your question, we are certainly firmly in support of universal health coverage. In the South African context, many of us appreciate the fact that the inequalities in access to healthcare is something that should concern all of us, especially here in our country where we embrace the principle of Ubuntu.
Absolutely.
It should not be that somebody who may not have the means to access healthcare should suffer simply because of that. So in that context, and I want to emphasize again, our position here is with reference to universal health coverage as an overarching objective, and that we are fully in support of.
Amazing. And I like what you said, that in the context of South Africa and the issues that we face as a country, what are your concerns regarding NHI, Bill?
The point that I need to make first, again, if you don't mind just bearing with me, is that with the bill having been signed into law on the 15th of May 2024, it has evolved to what now has become an act. But we have to appreciate that in the course of the conversation, we may still make reference to the bill and the act, interchangeably. The concerns that we have in as far as the act is concerned are multifold. And the first one relates to the fact that the NHI Act, as it stands now, suggests that when NHI is fully implemented, medical schemes will not be able to offer whatever is available via NHI. This imposes a limitation on the role of medical schemes.
Correct.
And in our view, that is immediately unsustainable given how huge this challenge is from a South African perspective. So that's the first challenge that we have in relation to the NHI Act as it is now. The second one relates to quality of care. Now, allow me just to elaborate very quickly in this specific instance. If one considers the capability of all those health facilities in the public healthcare space, there would be no argument against a point about the fact that many of those entities are currently not in a position to deliver quality health care. Now, we are concerned about how long it may take for us to get all these facilities in a position where, together with those facilities that are in the private healthcare space, are in a position to deliver quality of care. There's also uncertainty about how long it will take for us to get to a point where quality of care is delivered from all these facilities that are in the country.
Correct.
Thirdly, in South Africa, I think we can be forgiven for generally being concerned about our exposure to corruption and theft. I can make this point without throwing accusations, but the setup of the NHI fund, as it is envisioned in the NHI Act now, is such that it is very vulnerable to corruption and theft. So this is another concern that we certainly have about NHI. The next one is around the uncertainty as far as where the funding will come from. Some of us would like to argue that we mustn't worry about that, at the moment, but it's just so difficult not to worry about it, especially given the limitations in as far as the tax base is concerned in the South African environment. So these are some of the challenges that we have about the NHI Act as it is now. And as I'm talking, I've just remembered another one. The uncertainty also translates into the flight of limited skills as far as health professionals are concerned. Now, there's a whole range of other concerns that we had submitted as interested stakeholders when we had an opportunity to provide input on the bill. But I thought I would just highlight those for the purpose of our conversation today, Seth.
No, thank you for that. I think you've mentioned a plethora of notes, and you're stating that you're not against it. I think the areas of challenges and issues that our countries face, and the execution of the NHI Act is what we need to consider. So as you look at Bankmed and as the leader of the organization, I know you care about your members.
Absolutely.
How are you engaging with government stakeholders in relation to the points that you've made around the concerns that you have with the NHI Act?
Now, one of the points that I made earlier was around the input that many stakeholders were called upon to submit. Understandably, at the time, for consideration before the NHI bill would evolve into an act. What has been rather unfortunate, Seth, is the fact that those submissions that were made by many stakeholders in the country were unfortunately not given adequate, consideration. But to get closer to the question around what are we going to do, as Bankmed in this specific regard, we had decided many years ago that it would not make sense to engage with this matter in isolation as Bankmed.
That's good.
So we have organized ourselves into collective groups like the Health Funders Association, which is an industry body in the space that we are operating in. Now, the Health Funders Association is in turn a member of an entity operating as Business Unity South Africa, or BUSA. So it is through these structures that we intend to continue to engage the government every time an opportunity presents itself to do, just that. Now, notwithstanding the fact that previous submissions were almost ignored, for lack of a better word, we are certainly committed to consider other avenues that can be optimized to continue engaging the government. And unfortunately, it's also important for me to make the point that to the extent that we had exhausted all other avenues before, we found ourselves at a point where the one remaining avenue was to launch a legal challenge against the NHI Act. And there is already work underway in this regard from a variety of stakeholders. And there are also plans underway to finalize the strategy in as far as how this matter will be, engaged with. So these are the things that we will be, doing, going forward. And to the extent that at any point in time, there are developments that require that we give our members and the general public an update on what is happening, we will certainly do that.
Absolutely. And I like in the beginning of this conversation, you separated universal health coverage in the NHI bill. Do you think there's a need for educating the public around the two differentiators so that almost they have knowledge and awareness around the resistance towards NHI versus the universal health coverage?
I absolutely believe there is a need, for that. With the support of my communication team at Bankmed, when we sent communication to our members recently, we did realize that in many instances, in as far as the position that is expressed by many stakeholders in the public domain, as I indicated earlier on, the position has generally been in favor of universal health coverage, but having concerns about NHI as a vehicle to pursue universal health coverage. So in our thought process, we believe that it is important to make that distinction. And in a frequently asked questions document that we complied, we address that so that our members and the public in general can start having an appreciation of what the distinction is and what the fuss is all about in as far as this matter is concerned. So absolutely, it's important for us to educate the general public in this regard so that we can all move from the same information base about what this means and avoid a situation where we are having debates and arguments that lack the actual detail and the information about what we are dealing with.
And to that point around universal healthcare, what's the impact? So I think there's a consensus around universal healthcare being essential, but what's the short-term and long-term impact to medical schemes in relation to NHI?
Yeah, so now one of the points that I'm picking up from the question that you are raising, Seth, relates to timelines, and you have touched on short and long term. Now, the point that I want to make now, it will make sense a bit later, is in my view, I believe 10 to 15 years is probably a long time to a bit more than that. Now, let me just add context to that. Right now, there are challenges that are being launched from a legal perspective where the NHI Act is concerned. That in itself, we will require, some time for that process to unfold. And what you can pick up from what I'm saying regarding that point is that this process or the implementation of NHI will take time for a variety of reasons, including the fact that there are legal challenges launched against it right now. The second one, which is specific to timelines, there is quite a bit that is unknown about how long it will take for NHI to be implemented, in full. The best estimates that are out there suggest 10 to 15 years, and this is why I was referring to 10 to 15 years, earlier on. In my view, that's a long time. Now, this is relevant to the question that we had raised about the impact on medical schemes in the short, to long term. The third point, even when NHI is fully implemented, and this is with reference to the provisions of the Act right now, indications are that when NHI is fully implemented without a definition of what that means, when NHI is fully implemented, it's only then that the medical schemes will not be able to offer whatever is provided via, NHI. Now, the last point that I want to add to this, which is unfortunate, but it relates to the financial constraints that our country is navigating through. Those financial constraints are such that in all likelihood, implementation will take a while. And when implementation has been exhausted, for lack of a better word, it is unlikely in our view, Seth, that NHI will be able to provide tangible benefit to the whole South African population.
Absolutely.
So if we take all those factors into account, and these are the factors that we outlined in our communication to our members recently, really appealing to them not to panic because the implementation of NHI will certainly take a while. So the short answer to your question is it will really take a long time, but we are not complacent about this, and it's partly for that reason that I am pleased we are having this conversation.
Absolutely.
Because the promise that we have made to our members is that we're going to stay engaged.
Amazing.
And as and when it is necessary to update them on the latest developments, we will do that. So we don't want to be dismissive about this important matter. It is important, but there's no reason for our members to panic because we still have it at the top of our list of priorities.
And if there was an opportunity to restructure the NHI, the legal process goes through, there's consensus with government, the private sector.
Yes.
What would it look like? What would an updated NHI bill look like that would serve both the country's needs, but also medical schemes in South Africa?
What becomes important in how we drive this initiative towards a solution that is inclusive and is in the best interest of all South Africans, we cannot do it without collaboration.
Absolutely.
You have to remember that the very idea of universal health coverage, by the way, is attributable to deliberations at the United Nations. And this is where progressive nations of the world get together and agree on aspirations that are in the best interest of society at large. My reading of that is the concept of universal health coverage is born out of collaboration.
Absolutely.
From the word go. So for us not to feed that collaboration in how we navigate our way towards the desired solution is quite unfortunate. But to get closer to your question, collaboration is certainly going to be critical, and the role that can be played by medical schemes should not be limited. We stand to achieve a lot together if we really align our interests and make sure that we prioritize the citizens, of the country. And there is evidence of this having worked very well during the COVID-19 years,
absolutely.
where there was collaboration between the private sector, and the government, and the results were phenomenal. So it is really from those kind of experience that the appetite on the part of the private healthcare sector is very rich to collaborate, and we will continue to pursue all avenues available, to collaborate. The solution would have to be inclusive.
Yes.
It would have to enable medical schemes to continue to exist alongside NHI in a manner that certainly elevates the delivery and access of healthcare to all South African, citizens. So if you were to corner me for a short answer, I would say collaboration, cannot be avoided. There is no way we will make progress in this important and noble initiative without collaboration.
And what I appreciate in this conversation is that there's awareness to, there's a willingness rather than awareness. There's a willingness to want to collaborate. And what I appreciate is also, as a sector, you've all come together to advocate as one voice. And I also appreciate the elements of educating your current members on the NHI, because I think as a nation, and speaking for myself, I think we all were frightened and we were panicked. And we didn't understand what was going on. So I think the education and the awareness building is essential to also bring members up to date on what's going on.
I fully agree. The benefits that come from educating the public also include, pushing away a wrong narrative about this matter, and that's quite important. So we're still hopeful that the parties that are engaged on this matter will really find each other. If we don't, at the end of the day, it is the the healthcare citizens that
Absolutely.
will end up suffering. And I think it's important that I make this point, Seth. The fact that we find ourselves having to deal with this matter by opposing it from a legal perspective is really unfortunate. And it will really result in the legal fraternity being the only beneficiaries in this instance. So I'm still hopeful about the different players and stakeholders finding each other, because this is important and it is in the best interest of the South African citizens in general. And in my case, it is certainly in the interest of Bankmed members.
Thank you, Teddy. It's been an insightful conversation.
Absolute pleasure.
Don't forget to subscribe and to join us next week as we take a look at the current status of the National Health Insurance Act with Professor Alex van der Heever. Till next time. Proudly brought to you by Bankmed.